Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. It's my privilege and honor to have with me and have conversation with Dr. Carolyn Henry, who is a professor here at University of Missouri. And her specialization for a long time has been oncology, and she has produced some outstanding students who are become leaders now. So Dr. Henry has long-term experiences as a clinician, as a teacher, administrator. She was dean of the Veterinary College at the University of Missouri for many years, and now she's a director of this relatively new program of human-animal interaction. Again, it's an honor really to be with Dr. Henry. By the way, as a side note, we are meeting each other after about 30 years. We were together at Washington State University, so it's very nice to be with Dr. Henry. So, Dr. Henry, please go ahead and introduce yourself, if you wouldn't mind, briefly, so that our viewers know, all the, hard road you have taken and where you have reached now. Please.
Well, it's a pleasure to be here, and it's great to catch up with you after all these years. My background, as you said, was in veterinary oncology. I did my training at Auburn University in Alabama, and then from there went into my first academic position, which was at Washington State University, where we met. And then I've been at the University of Missouri since 1997, if you can believe that, and started the oncology program here, and then gradually found myself in administration unexpectedly, as it were, and was associate dean for research here, and then moved into the deanship that I did for 6 years. My background here has given me insight, I think, into veterinary education and how that's changed through the years. Experience in the different specialties within veterinary medicine and how those are evolving, and some of the topics I think we're going to touch on today in this session.
Thank you, Dr. Henry. I think the question comes to my mind, you being a leader, one of the leaders in the United States in our veterinary medicine, you being a female yourself. I remember those days where, veterinary medicine was dominated by men and women were fewer, but now that has changed completely. In our veterinary colleges, we have female students somewhere around 80 to 90% sometimes. And then the leadership has also changed. We have quite a few deans, and Dr. Henry, you were dean yourself for so many years. Give us some insights. What do you think the gender change has done to our profession? What are the strengths there? Or if you see any downside, I would love to hear that. Please.
Yeah, and I'll also add, as you know, my late husband was a food animal veterinarian, and so have always been cognizant of not just small animal medicine, but large animal medicine, and where women come into that as well. So even when I was in school at Auburn, back in the 80s, we had a predominantly male class, and it was right after that, I think 1990 is when classes started kind of crossing over that threshold of 50-50 and moving more towards having female members of the classes. So I think there are some factors that have come up in that change. One being equity of salary, and so I think traditionally women have been paid less for the same type of work, and that's certainly changing in our profession, especially as we get more female leadership. So I think that's a positive. I think the profession has become more aware of the need to balance family life with your work life, and we talk about that work life balance, and that means something different to everyone. But for many of us that had families and kids, it's difficult to keep the hours that most veterinarians traditionally had kept and also raise a family. And so I think that's something that we've become more flexible as a profession, and we've recognized the importance of that. Um, and I think the leadership is still lagging behind. So if you look across, especially the academic medical centers, there's still a predominance of males in those senior leadership positions. But as you said, even that's changing. And so being a female dean, I was the first female dean here at the University of Missouri, but that's kind of not not as unusual anymore. And I think that leadership is changing some of the ways that we look at the profession overall. So, of course, as a woman, I see it as a positive. But I also, as someone that was recruiting students here, I don't want to see it become too one-sided. And I think we're trying to encourage more males to still consider veterinary medicine as an option because they're a very important part of our profession.
Dr. Henry, other question is that yourself and me too have taught students, interns, and residents in veterinary teaching hospitals, and at least I thought that that's a very important place that we trained our future veterinarians. But now all these new veterinary colleges are coming up, and they have found a way to ship our students out to field and to the veterinarians and to learn there. So there are positive and negatives. The people who are against that concept of not having teaching hospital, they think that this is like a white elephant. You have a lot of money, and the taxpayers' money is being wasted sometimes, and we don't need all these monster buildings. And the people who are in favor of that, they think that we are really working against ourselves because the training and the curriculum we provide, and we have the supervised training of the future veterinarians, they cannot be substituted by our private practitioners who have a lot of pressures on their own of making money and get case moving through. So a person like yourself, a leader, I'm sure you have been in those conversations. What is your insight on that?
Yeah, that's a big topic right now, and I will start by saying I came into these conversations very biased against these new models. Having been in a traditional setting my whole career and through my training, that was just what I thought was the highest quality way to train students. I've softened on that, I'll admit, through the years as I've seen the new models, um, I think, become more efficient and offer opportunities for our students that are rather unique. I think the biggest concern I've always had is quality control. So wherever our students are being trained, how do we ensure that the quality is there and it's consistent? And I think that's in part dictated by our Council on Education and making sure that these practices, if they're going out into private practices, that they're being held to the same standards. I have to say, though, I do see some benefits in sending students to these sorts of clinics. Some people would say it's more real world than a specialty hospital. And I think, if you're in a specialty hospital that trains house officers, so interns and residents, oftentimes you'll have in a surgery suite, you'll have the patient on the table, you'll have the primary clinician, and you'll have the resident and the house officers next. And then behind them, you'll have vet students. And so you may be 3 people away from actually being able to take part in that training. And so if you go into a practice where you've got fewer people in the room, you're going to get more hands-on, and I think that's an important part of their education. I personally favor a hybrid where they get exposure to all of it because it's such a vast profession, and I like to see our students be exposed to all the different possibilities that they have when they are going to go out into practice and into the profession and possibly changing their career within that profession several times.
My last question, Dr. Henry, is that as you know, we hire our faculty members on tenure track positions or on clinical track. So as you know, the clinical track is more like a contract, it could be 2 years, could be 3 years renewable. Whereas the other tenure track is that we hire a person on tenure track, and then if he or she fulfills all the requirements after 5 years or so, in most of the places they become tenured. Means they have almost, a job for life in a way. So that's one thing that which has been concerned for some people. Is it a good thing to have clinical faculty or not? And some of the clinical faculty even feel that even though we have a contract, but still we are kind of supervised or ruled by a tenured faculty. So that's one area. The other thing within the teaching hospital, the issue is to hire a specialist. Luckily, I'm very happy to see that our veterinary specialists are in high demand, and it's very difficult to keep them in teaching hospitals because we just can't compete.
Right.
We just can't pay them that much. Do you have some insight on these two different aspects of it, please?
Yeah, I mean, as a dean, you struggle with this every single day. So, the dichotomy is if you have a teaching hospital, your primary goal is to have high quality teaching for the students, but you have to balance that with they have to be sustaining. You have to be able to make money, and that becomes very difficult when you have students in the mix because it slows down production. And you're using more materials, more syringes, more gloves, all of that. And so, we always say if you want to make an academic medical teaching hospital financially successful, get rid of the students. But then you have a specialty hospital as you would out in private practice. And so, it's a balance. And I think the days of having tenure track faculty that do all three missions between teaching, research, and service, that's a very heavy lift. And to be able to hit the research and publication marks that you need to get tenure as a faculty member, your priorities are shifted from those of someone that's clinical track and focused on really clinically teaching the students and serving the community that brings their pets or their livestock to the hospital. So it is a conundrum. I think academic medical institutions are at risk of having trouble surviving because it's becoming more difficult to find the specialists to work that also want to teach when they could be in private practice working fewer hours and certainly making more money. So it's the special breed that wants to do all three of those things, the research, teaching, and service. But there's also the need to have mutual respect of everybody's role within an academic hospital and the very critical role that clinical track faculty serve. I think we're going to see more and more schools go to a either predominantly clinical track or at least half and half, and we're going to see fewer tenured faculty is my prediction for where this is going to go in the future.
Thank you very much, Dr. Henry.
Yeah.
It's a pleasure to see you again after such a long time. And I'm sure this insights which you have shared with us will be helpful and maybe guidelines for many of our younger upcoming leaders in the profession.
Thank you so much. Appreciate this opportunity.
Yeah. Thank you again. Bye-bye.